If you wake up and your brain feels wrapped in cotton, you're not imagining it. Morning brain fog is usually a signal that something in your sleep, blood sugar, hydration, or stress system didn't reset well overnight. The good news is you can often narrow it down with a few simple checks. Start by noticing the pattern. Is it every day, or only after late meals, alcohol, or short sleep? Does it lift after coffee, after breakfast, or only by midday? Those clues matter because brain fog is not one thing. It's a mix of attention, memory, and mental speed, and different causes create different flavors of fog. In this breakdown, you'll get a practical map. We'll cover the most common reasons people wake up foggy. Then we'll talk about what might help right away and what's worth discussing with a clinician if it keeps happening. Let's start with the foundation: sleep quality, not just sleep time. Moving to slide 2. Most people think brain fog means you didn't sleep long enough. Sometimes that's true, but quality is often the bigger issue. You can get 8 hours and still wake up foggy if your sleep is fragmented. Common disruptors are noise, light, a hot room, pets moving around, or waking to use the bathroom. Another big one is inconsistent sleep timing. If your bedtime swings by 2 hours, your circadian rhythm gets confused, and your morning alertness can lag. A simple experiment is to keep the same wake time for a week, even on weekends. Then protect the last hour before bed. Dim lights, reduce intense work, and avoid doom scrolling that keeps your brain on call. If you nap, keep it short and early. The goal is deeper, more continuous sleep cycles. If your fog improves with consistency, that's a strong clue the root issue is sleep architecture, not willpower. Moving to slide 3. A surprisingly common cause of morning brain fog is breathing that's slightly off during sleep. You don't need dramatic snoring for this to matter. Even mild sleep-disordered breathing can reduce oxygen and fragment sleep without you remembering awakenings. The result is waking up unrefreshed, with headaches, dry mouth, or a heavy hungover feeling. If a partner notices snoring, gasping, or long pauses, that's a strong flag. But even if you sleep alone, pay attention to clues like waking with a sore throat, needing lots of caffeine to function, or feeling better after sleeping on your side. What might help quickly is positional changes, nasal breathing support, and avoiding alcohol close to bedtime, since it relaxes airway muscles. If this sounds familiar and it's frequent, a sleep evaluation can be high value. Treating the underlying breathing issue often improves morning clarity. Moving to slide 4. Another big driver is blood sugar instability overnight. If you eat a very sugary or refined carb dinner, your glucose can spike, then drop later while you're asleep. Some people wake up foggy, shaky, anxious, or unusually hungry because stress hormones rise to bring blood sugar back up. On the flip side, going to bed underfueled can also backfire, especially if you train hard or have long gaps between meals. What might help is building a steadier dinner. Think protein, fiber, and healthy fats, plus carbs that digest more slowly. Also watch late-night desserts and sweet drinks. If you wake at 3 or 4 a.m. and your mind is racing, that can be part of the same pattern. If you have diabetes, prediabetes, or symptoms like frequent urination and intense thirst, it's worth getting labs checked. Stable blood sugar often equals a clearer morning brain. Moving to slide 5. Dehydration is an unglamorous but real cause of morning fog. You lose water overnight through breathing and sweat, and if your room is dry, you lose more. Even mild dehydration can affect attention and mood. A clue is waking with a dry mouth, dark urine, or a headache that improves after fluids. What might help is making hydration boring and consistent. Drink water across the day, not just at night. If you chug water before bed, you may just wake up to pee, which fragments sleep. In the morning, start with a glass of water and give it 10 minutes before judging your brain. Electrolytes can help some people, especially if you sweat a lot, eat very low carb, or drink a lot of coffee. But more isn't always better. The goal is steady hydration and enough sodium and potassium from food, not extreme supplementary intake. Moving to slide 6. Caffeine can both help and cause brain fog, depending on timing and dose. If you rely on coffee to feel normal, you may be treating sleep debt or withdrawal. Many people wake foggy partly because their brain is waiting for caffeine to restore alertness. There's also the cortisol awakening response. Your body naturally ramps up alertness after waking. If you slam caffeine immediately, some people get jittery, then crash later. What might help is a small timing tweak. Try waiting 60 to 90 minutes after waking for your first strong coffee, and see if your focus feels steadier. Also check total intake. Too much caffeine can worsen anxiety and reduce deep sleep, which then creates more morning fog. If you drink caffeine after mid-afternoon, experiment with cutting it earlier. The goal is using caffeine as a tool, not as a replacement for recovery. Moving to slide 7. Alcohol is a common reason people wake up mentally slow, even when they don't feel hungover. Alcohol can increase sleepiness at first, but it disrupts sleep later in the night. It tends to reduce REM sleep and increases awakenings as your body metabolizes it. It can also worsen snoring and sleep-disordered breathing. The next morning, the brain fog can feel like poor memory, low motivation, and irritability. What might help is testing a simple boundary. Keep alcohol earlier, keep it lighter, and give yourself a few alcohol-free nights to compare. Also pair it with water and food, not to cancel the effect, but to reduce the intensity. If you notice a strong connection between drinking and fog, that's useful data, not a moral judgment. Your nervous system may simply be sensitive to sleep fragmentation, and alcohol is a reliable fragmenter. Moving to slide 8. Stress is not just a feeling. It's a physiology that can follow you into sleep. If your nervous system stays in high alert, you may fall asleep but not fully downshift into restorative stages. Some people wake up with a tight chest, a racing mind, or immediate dread, and that can look like brain fog. Cortisol and adrenaline can also rise if you're underfueled, overtraining, or dealing with chronic worry. What might help is a short, repeatable wind-down routine. Keep it simple. 10 minutes of slow breathing, a warm shower, light stretching, or writing down the 3 things your brain keeps looping on. In the morning, get bright light and gentle movement to tell your body it's daytime. If anxiety or low mood is persistent, addressing it directly through therapy, skills training, or medical support often improves cognition as a side effect. Moving to slide 9. Your bedroom environment can quietly create brain fog. Temperature is a big one. Many people sleep better in a cooler room, and overheating can increase awakenings and reduce deep sleep. Light matters too. Even small amounts of light can suppress melatonin in sensitive people. Noise spikes can fragment sleep without fully waking you. What might help is a quick environment audit. Make the room as dark as you can, keep it cool, and use breathable bedding. If noise is unpredictable, consider consistent background sound rather than sudden silence. Also think about air quality. If you wake congested, allergies or dryness may be interfering with breathing. Cleaning bedding regularly and managing dust can help. None of this is fancy biohacking. It's basic friction removal. When your sleep is less interrupted, your brain gets more uninterrupted time to consolidate memory and reset attention networks for the next day. Moving to slide 10. Nutrient deficiencies and low iron status can show up as fatigue and brain fog, especially in the morning. Iron helps carry oxygen, and low ferritin can leave you feeling weak, cold, or mentally slow. Vitamin B12 is important for nerve function, and low levels can affect memory and mood. Vitamin D is linked with overall energy and immune function, and some people feel worse when it's low. The tricky part is symptoms overlap, so guessing can waste time. What might help is focusing on food quality first. Protein, legumes, leafy greens, seafood, eggs, dairy if tolerated. If you're vegetarian, vegan, pregnant, have heavy periods, or have digestive issues, your risk can be higher for certain deficiencies. If fog is persistent, asking a clinician about targeted labs can be more useful than random supplements. Supplementing without knowing levels can miss the real issue. Moving to slide 11. Some medications and supplements can contribute to morning fog through sedation, blood pressure effects, or sleep architecture changes. Common culprits include certain antihistamines, sleep aids, and some anxiety or pain medications. Even natural supplements can linger into the morning depending on dose and your metabolism. This doesn't mean they're bad. It means timing and fit matter. What might help is doing a clean review of everything you take, including over-the-counter products. Note the dose and the time you take it. Then look for patterns. Did the fog start when something changed? Do not stop or change prescribed medication on your own. Instead, Bring the pattern to your clinician or pharmacist and ask about alternatives, timing adjustments, or side effects. Also consider interactions, like alcohol plus sedating antihistamines. A small tweak can sometimes remove a big layer of brain fog. Moving to slide 12. If you want something you can try immediately, use a simple morning reset sequence. First, hydrate, water, then give it a few minutes. Second, get bright light in your eyes, ideally outdoors to anchor your body clock. Third, move for 5 to 10 minutes. A brisk walk, mobility, or a few bodyweight exercises can increase blood flow and reduce sleep inertia. Fourth, eat a balanced breakfast if you do well with breakfast. Protein plus fiber is a good default. If you don't like breakfast, at least avoid starting with pure sugar. Fifth, delay heavy decision-making for 20 minutes if you can. Let your brain come online. None of these are magic. They're levers that nudge alertness systems in a predictable way. If this routine helps, it suggests your fog is more about physiology than motivation. Moving to slide 13. Sometimes brain fog is a sign to look deeper. If you have loud snoring, witnessed breathing pauses, or extreme daytime sleepiness, sleep apnea should be on the list. If you have persistent low mood, anxiety, or loss of interest, mental health can be the driver, and treating it often improves cognition. If you have heavy periods, hair loss, or cold intolerance, iron or thyroid issues are worth discussing. If you wake with headaches, high blood pressure, or chest symptoms, don't ignore it. Also, pay attention to duration. Occasional fog after a late night is normal. Fog most mornings for weeks is different. The goal is not to self-diagnose. It's to bring clear observations to a professional, so the right tests happen sooner. If you want one simple next step, keep a 7-day log. Sleep time, alcohol, dinner, caffeine, and morning clarity from 1 to 10. Moving to slide 14. Here's the big takeaway. Morning brain fog usually has a few repeatable causes: disrupted sleep, breathing issues, blood sugar swings, dehydration, stress, and timing effects from caffeine or alcohol. You don't need to fix everything at once. Pick one lever, test it for a week, and watch what changes. That approach turns fog from a mystery into a feedback loop. If you want a simple starting point, I'd choose consistent wake time, earlier caffeine cutoff, and a darker, cooler room. Then add the morning reset: water, light, and movement. If you try this and nothing changes, that's also useful information, because it points toward labs or a sleep evaluation. If you found this helpful, subscribe for more practical health explanations without the hype. And comment with your experience. Do you wake up foggier after a late meal or after alcohol? A or B? This information is not a substitute for medical